Okay, good afternoon, everyone. I'm Beth Sarmiento, your new recruitment ACE consultant, and I would like to welcome everyone for today's webinar hosted by Whakatane Hospital. So today you will be hearing from the employers' representatives and RMO representatives regarding the employment processes and RMO's experience in working in the hospital. For the Q&A session, we'd like to encourage everyone to put in their text-based messages using the Q&A function in the Zoom. Or if they would like to ask questions live, they can just use the raise hand function. And our panelists will be happy to answer any questions. So I'd like to turn over the introduction for our panelists.
My name is Dr. Kelly Phelps. I'm one of the ED SMOs as well as one of the pre-vocational supervisors. And I'll let the other ladies introduce themselves. But thank you for joining us.
Kia ora, I'm Annika, one of the PGY1s at Whakatane Hospital.
And kia ora everyone, I'm Nikita, I'm also PGY1.
Kia ora, I'm Anna, I'm one of the PGY2s.
Hi, I'm Chantal and I'm in the medical staffing unit.
Fantastic. So the Whakatane Hospital's put together a promo video amongst ourselves. It is not professional, so it's all just what we do. Music is actually from one of our pre-vocational supervisors' husbands, so it's a fun little thing. And please interrupt me if you can't hear it.
Hi, I'm Kelly, one of the ED doctors as well as one of your possibly future pre-vocational supervisors. Here with me is Dr. Jen Lehman, one of our medicine consultants.
Everyone here is really great, so supportive, and yeah, really help getting lots of hands-on learning, and yeah, it's just been a great transition from being a TI to being a doctor.
I'm Anna and I am from Wellington. I'm working in Whakatane for the last 2 years. It's a great hospital to work in. It's a great, friendly, small team, so you get to know everyone. You get lots of experience and learn to kind of do procedures and manage patients and situations independently from really early on. It's a great area to be in. Whakatane is great, it's got lots of beautiful running tracks, probably the best sunrises in New Zealand and great for learning to surf.
Assalamu alaikum, أنا اسمي مصطفى تعلوفة ولو مصطفى. Kia ora, my name is Mustafa. I'm a Samoan Egyptian, born and raised in Auckland, and I'm currently a PGY2 house officer here in Whakatane Hospital. And I love it. If you look at the sunset there, absolutely amazing. I love the work-life balance that we have. I love the connected community we serve. All the people that I work with, amazing, you know, connectedness, almost horizontal social hierarchy in the hospital. Great MDT, very good interactions. In terms of outdoor experiences, I love surfing, fishing, hiking, you name it, mountain biking. We've got it here at Whakatane Hospital. So I look forward to working with you soon.
What it means is Grace Lee. Hi everyone, my name is Grace Lee. I'm a Taiwanese Kiwi and I am working as a registrar in Bioplan team for the last couple of years. So I worked as a PGY1 and 2 in Whakatane in 2016. The particular things about Whakatane Hospital that I have enjoyed was noticing that there is a really small team, but very supportive staff around. You really know your colleagues and you get to do any practical procedures and assessments and treatment plans, which would be taken by registrars in any larger hospitals. So you can do it here with great supervision by the team of SMOs.
Hi everyone, my name's Tui. I'm one of the PGY1 RMOs here in Whakatane. I've been here for a couple of months now. I've been very lucky, especially for this video. I can remember watching this video last year and going through the same process as you guys are now, and I can remember looking for somewhere where I would get exposure to a broad range of things and wanted to be part of a friendly team, and I've certainly found that here in Whakatane. I think you guys should seriously think about putting Whakatane up top in your list because I found SMOs are really friendly, really good at teaching, and the lifestyle here is amazing, incredible weather, and lots of things in the outdoors to do. Yeah, put Whakatane #1.
Thanks guys, I hope you enjoyed that video and gave you a bit of a laugh. That's what we're all about. So without further ado, I'll start with this little PowerPoint here. So that's a little bit of our entrance to our hospital, and welcome you to Whakatane. So we'll start kind of briefly on what we do through ACE and who we're looking for. We've done this a couple of years now, and there's a couple of Q&As from previous years that I've kind of answered on the end, but please do put some questions in everywhere from where you can walk your dog to anything you want to feel like asking. We're quite open and honest. So here we are, we introduce ourselves just a bit briefly here earlier. You'll have Anna, Nikita's, and Arnika's emails there, as well as Chantel's. If you do feel like visiting or have some last minute questions, if you're like me and you exit a webinar and go, forgot to ask a question, feel free to send it on through. Your pre-vocational supervisors through medical council, myself, I'm Kelly, and then Katie and Owen also send their regards to say hello. They're both on call, but are open to being contacted as well. So you've already kind of seen some of our promo video. I asked the RMOs to send us videos and pictures, and they sent us family and lots of fur baby pictures and what they do. Some of those are photos from the annual hospital ball as well. So you've gone through a couple of webinars already. It's very similar to other hospitals. Put your applications through. Our kind of team here in Whakatane is we do put RMO input. So we have the PTY 2 or 3 on the panel. The medical staffing like Chantel and myself and Mahi Health and some of the other supervisors or SMOs all review the applications. What we kind of look for is, high academic, how well you did in medical school, your reference letters, your CV, what you've been up to outside of medicine, and what your aspirations for. So that's just kind of what we look for as well. We do interview. We don't interview a lot. We maybe do about 10 or so. It just kind of depends on our work schedules, how many we get through. Don't always worry if you don't get an interview. It is what it is with the process. Our rankings are put in through ACE, and then from there. Is a visit required? Not essential. We do get to know some of our students from before, but if you don't know us, please come contact us. Please have a visit to Whakatane as a feel for you and your family in Whānau. So, and if we can help coordinate that with Chantel here, and that's your email. Polling everywhere from nurses to RMOs and just our community per se. We look for respectful, compassionate, adaptable new junior doctors. That's how we kind of recruit, because that's where we kind of like ourselves. And yeah. So previous questions and answers from previous years is what kind of clinical runs do we offer here at the hospital? New on the road is all this community-based clinical runs. We'll talk about that. And what orientation is like and what teaching is like. So Whakatane is a generalist kind of hospital. We've got general medicine, orthopedics, gen surg, psychiatry, pediatrics, O&G, emergency relief runs, and the CVAs. General medicine is all coming. We don't have specialty cardiology, so they get gastro, they get infectious disease, they get respiratory. It's a whole bunch of slew in there. Same with general surgery. They're doing all kinds of surgeries, from hernias to gastrectomies to
Vascular things.
Vascular things, exactly. I put a quick little note down at the bottom because someone asked about an ICU and anesthesia a few years back. We consider our hospital an open ICU. So you will have, even on your rounds with general medicine, you may have some in the acute care unit in the ICU, and then you have some on the ward / COVID wards. You will be on call with ICU patients from day one, with support, of course. But I mean, that's the thing. So that's, you guys are laughing, but you will get procedures through an open ICU, even in your first and second year. Community-based runs are coordinated with our sister hospital up the road in Taronga. There's a selection of sexual health, public health, hospice, and Takaha Clinic in the East Cape, which is a fantastic run. Some of you have done it as students, some of you guys have done it as PGY2s. It's a great experience. And there's some developing in the background that I'm not allowed to talk about, but maybe soon. Other ones had talked about orientation. I'm not quite sure what other hospitals do, but we've really pushed and worked hard to get a full week prior to even starting as day one. So your first week, granted it's a computer training, and but there's time for socializing with the RMOs and learning what you're supposed to be doing a week from now, and you're buddied, that kind of thing. You get a whole day of your ALS training, even if you did it as a student, which I get to help teach you guys, which is really fun to see you guys bonding. As you know, you don't maybe need each other as med school, maybe you didn't. And you get the first time to actually work as a team, which is a quite nice little team building day. Full on, but really fun. As far as teaching, I don't know if you guys are familiar with the app, Med app. It's how we kind of communicate with what teaching is on through the week. You'll get teaching most days. Grand rounds are on Thursdays. You get taught by mostly your SMOs, so senior consultants on general surgery, medicine. You do have a handful of teaching from registrars, but the one-on-one with them. There's simulations that you probably saw some photos of on the promo video going through ED. Some of our SMOs love to teach through games. So there's everything from Pictionaries to things like that. So they're not always didactic things. Trying to re-get Maori health into the scope is getting those education sessions back for 2024. So that's working in the background, which had great feedback. And then COVID kind of happened. So as you do, trying to get back on your feet. Yeah, so that's what we offer. And put those questions in. I hope I answered most of them. But we have a lovely panel that'll be quite honest for that. There we go, and I will stop sharing this, hopefully. How's that sound? Do you see any, does anyone have any questions? Don't see any.
We don't have questions yet, but I think they're also waiting for the RMO representatives to share their experiences working in your hospital.
Oh, you want them to, oh, okay. Well, there you go.
On the spot.
On the spot. So we did.
Who wants to start?
Yeah, I can. So yeah, kia ora again, I'm Anna. So I trained in Dunedin, or I'm a Otago graduate, and then was in Christchurch. So I just wanted to let you guys all know that Otago grads can get jobs here as well. We had 2 in my year and then 2 in the following year. And I chose Whakatane because I had a few placements in TR year in smaller, more rural hospitals, and I really enjoyed that type of environment. And then I had a good friend who was up here, and she had really enjoyed her experience. So yeah, I applied for a job here and have not regretted it at all. I think one of the great things about here is just the small environment and the small team. So you get to know your group of house officers super well. You get to know your MDT super well, all the bosses, all the HCAs, all the cleaners. Everyone's a familiar, friendly face. And that kind of flat hierarchy, I think, is pretty unique to smaller hospitals. You definitely get challenged in many ways, and I think quite earlier on, just from the fact that we don't have many registrars. So you are put in the position where you get to make a lot of clinical decisions yourself. But in saying that, all the bosses are aware of that, so are only a phone call away. And I think the small nature of the hospital also means that you have a lot more opportunity to, for example, do the runs that you want to do, or if there's any certain procedures, then it's about talking or chatting to someone who's able to teach you about that procedure. This year I am doing peds for 6 months, and you get to do the pediatric diploma if you want to. Similarly, you have the opportunity to do O&G in second year. You can do the O&G diploma, and then doing ED and going up to kaha. So nice variety of runs. And then obviously we kind of touched on it, but everything that there is outside of the hospital is, really epic. I think you do work hard when you're here, but, generally do finish most days on time. And especially over the summer, you've got plenty of hours of sunlight to go and do the things that you enjoy. I will hand on over.
Well, I'm Annika, and it's my sister Nikita. We were born and raised in Whakatane, so it's a pleasure to be back here, but not biased at all. What can we say? It's the best place in New Zealand, but no. Like Anna was saying, I think if you're looking for somewhere to have that work-life balance, Whakatane is a pretty cool place. You've got everything on your back doorstep. You've got amazing bushwalks or runs. You've got the beaches. You've got fishing, as well as any outdoor kind of thing you want to do, really. And then it's only a short drive up to Tauranga if you're more into your shopping or things like that. We do have all the shops. People kind of don't realise we've got McDonald's, we've got KFC, we've got BK, we've got the warehouse, even got all 3 supermarkets, so don't worry. We are a little bit civilised. In terms of the hospital, I mean, my first 6 months have been great. We've got very supportive staff. I mean, you get all the bosses' phone numbers on your own phone, and it's never hard to make a call to them. I think previously in bigger hospitals have always been a bit kind of shy about ringing bosses and things. You'd always plan out what you're going to write, but here you just kind of ring them and go blah 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 blah. And it's very easy. I think probably the most scary thing for me coming to Whakatane was knowing you had to do long days on your own, but your first 1 or even 2, if you want, can be buddied, and I think you soon pretty get the ropes of it, and you understand that it's not actually as scary as what you think it's going to be, and just knowing there's always someone to call that's higher up if you've got any questions. So it's really a pretty awesome place to work.
Yeah, kia ora everyone. It's pretty much the same as what Anna and Annika said. It's the best place to work in my opinion. I just love the small community. It's so easy to get help from anyone. You can literally just walk down to radiology if you want to speak to a radiologist. You can walk to the surgical ward if you want to speak to the surgeon. everyone's on first name basis, so it makes asking for help super easy. It's more like, oh, hi Peter, it's me. Oh, and you're like, oh, is Mrs. Smith's heart playing up again? You know, it's like real informal. You don't have to stress out before planning everything out before a phone call. Everyone's really friendly. Everyone from HCAs, nurses, cleaners, everyone. And just such a good work-life balance. After work, there's always something to do. Someone to go for a surf or a fish or mountain bike. Yeah, that's awesome. Yeah.
Anyone else?
I'll just introduce Katie. Just say hi, Katie.
Hi. I'm coming from yet another meeting.
Yes.
Okay.
Dr. Katie Steer is one of our pre-vocational supervisors as well. So.
Okay, actually, we don't have any other questions, no text-based questions yet in the Q&A function. So I just want to ask maybe on behalf of the applicants, you mentioned that you will be interviewing, right? And for other applicants who will not be interviewed, they don't have to worry about it. But I just want to know what would be your basis for your interview, meaning would you be doing it on a random list, or do you have a specific basis on how and who will be considered for an interview?
A good question. So most of our interviews are more likely trying to figure out who you are, or if we think you'd be really good here, but we may not know what your fit is like. That's what I find interviews are mostly what we're going for that. So, and we only get a chance to do 10. We get 6 hires from ACE. And so it's kind of it's kind of how we roll a little bit. Yeah. So does that answer your questions a little bit? So I kind of went through how, academic standing and where you're from, where you're local to here, where your EUE is. But if we don't know you so well, or we might shout you out an interview and to see what you are like. I think paper versus personal skills can be a little bit different. Yeah.
Okay. Now we have 3 questions here. One is, can they please repeat the things that they're looking for in an applicant?
So kind of like what our PowerPoints is if you have aspirations as a career choice to work in a rural community, or if you've kind of like Anna had done a little bit of rural stuff even before, if you're feeling like you're going to be a small hospital even in your future, it might be a good place to come here. Having said that, some people go off to big cities as well. So that's not a full underlined, bolded kind of thing. We take into consideration, like I mentioned just before, if your iwi, your whānau, if that's your center is here, we take into that consideration. What else? Anything else? Those are the main things. Yeah.
And you said put it in the cover letter?
Yes, and put it in your cover letter. We do read them.
I was reading the manual today and it said cover letter optional. No, cover letter not optional. Please write a cover letter.
I did see that. Yeah, your CV and your cover letters.
Yeah.
And your cover letter is not your CV in written form. Your cover letter is to express who you are. If no one knows who you are, is your memoir, but not necessarily where you went to school. And express why you want to go to Whakatane.
And they have to be specific to Whakatane because it could be like not to address it as a Bay of Plenty, right? In general.
Yes, please. Yeah. Yes, please. So we have a sister up the road. We can be very different. So.
Yeah, correct.
Yeah.
Okay. Second question: how many applicants will you accept this year?
6. We keep trying to increase that number, but 6 this year.
And third question is, how is the housing rental situation?
I think everyone kind of in my year did find somewhere to live in the same as the following year. But yeah, we were just discussing this just before. I think finding somewhere to live over summer can be quite difficult, just because it's quite popular up here in Ohope and Whakatane in general. But there generally seems to be a bit more luck if you perhaps have a group of people when you're looking for a house rather than just an individual room. I think in the past, if you've had difficulty finding somewhere to stay, giving an email to the RMO unit works quite well, because there's usually someone in the hospital who has a spare room or knows of someone who knows someone whose auntie has a house or something like that.
For sure. And as a supervisor, I kind of recommend you get a buddy or a housemate or roommate. It doesn't have to be in medicine, or, you know, some of them flat with the physios and things, because it's just that awesome, you know, friendship that, because it's tough anywhere you go, but it's a first challenging job, and someone who makes you a nice cooked dinner when you're home from a long day, it's kind of nice. So I encourage you, wherever you are, to actually get flatmates.
Okay. And then one of the house officers was sitting for exams, and her flatmate was one of the nurses here, and I was telling her to tell her, you need to study. So flatmate, so I can nag you in several directions.
That's exactly right.
Yeah, and she was my spy.
I know it's quite challenging to find a place, but how about the cost?
Better than Auckland.
Is it?
Yeah,
it's cheaper than Auckland. I think it's cheaper than Tauranga.
I think it's pretty standard nowadays, isn't it, really?
It can be like over the hill in Ohope is a little bit more expensive. I don't know, I think probably anywhere between, you hear people talking about 150 to 200 a week for a room. In Whakatane itself or in coastlands, it's a little bit cheaper. Yeah, around maybe 150 to 180.
If you're bringing your own family in a whole house, depends if it's furnished or not furnished. That could be everywhere from 5 to 7 a week.
Okay. Another question: is there a preference between Otago versus Auckland students?
Nope. Yeah, we kind of bring all comers. Nope. That's the short version of that.
Yeah.
No.
Both.
We do both, yeah. And I know Otago, so we're under the University of Auckland hat from all of the 5th and 6th years that run through us. But Otago has an excellent rural program as well. So if you've kind of gone through that, let us know. And if that's, it's always helpful for your application to promote that.
I think Otago wants to come here because we have sunshine.
So another one, not sure if this has been answered already, but is there also an option to do runs at Tauranga Hospital too?
Yeah, mostly in your second year. We try to keep you your first year for sure. Sometimes we grab an ED RMO from Tauranga that does our ED down here. Sexual health would be up in Tauranga, and it's not as swappy as you would think, but you are able to.
Yeah, Talia did that.
Yeah. To get a bit of more exposure, especially if you're surgical minded, you can do a gen search here and then another search place up the road. Yeah.
Okay. Sorry, I might have missed this one. Do you consider visits, and if ever they'll do visits, who should they contact with?
We do encourage visits. Please email Chantel over here. her email's on the PowerPoint as well as possibly the ACE contact.
Yeah.
She usually puts you with a buddy for an RMO of the day. We find weekends are a little harder because if most places that weekend RMO is running around doing jobs and things like that. So, and you'll meet somebody and meet more of the RMOs during a weekday, especially at lunchtime teaching. So if you can handle a Friday or a Monday or a zip over, that's a bit more encouraged if you can do a weekday. And if, of course, myself or Katie are around, we answer questions too.
Yeah. I think I caught one in the hallway the other day. It's like, who are you? What are you doing?
That is true. Who are you? We don't know you. Hello.
What's your name? Where are you from? Make sure to put things in your cover letter.
That's
Okay.
not right.
I've also thought another question, which I have seen in one of the webinars that I had previously. They were asking questions about how easy is it to get an approval for leave application.
Should we speak to
Yeah,
it?
yeah, I mean,
Yeah, I was going to do a plug. Like, I have heard some kind of horror stories from some RMO units, and I'd probably have to say, like, talking to other colleagues and stuff, we've probably got one of the best ones in the country, and they would do pretty much anything possible to make your leave. Like, yeah, not do anything. You know, it's like, it's my leave form now.
I don't think I've had leave declined, so yeah, pretty.
Neither. And I put him to leave the day before and still managed to get it. So
I was going to say there are still rules that surround
there is rules
that you should follow, because Chantel's very nice and she'll feel guilty and try to.
Yeah, if you put it in
follow.
reasonably early, then yeah, it's generally always accepted.
I will always try to accommodate where I can.
Yes.
Always.
And then having a good or bad RMO unit will change your life. No, really, like even as a junior, like I was more interested in meeting who the person was who approves that kind of thing. And so when I was at hospitals doing interviews, I wanted to go meet that person because it will, if they don't like you, or if they do like you, or if they're not good at getting back to you with emails, or they're always behind with getting your stuff to the council, that will ruin your life, but not Chantel.
But I don't have favourites.
But Chantel will get back to you in a timely manner, and she's familiar with who you are, and will complete paperwork in a timely manner. And yeah, it's a very important point that I think people overlook. I mean, sure, rotating with me will be great. You'll learn so much about medicine, and Kelly will teach you everything about emergency medicine, but having an RMO unit that's competent and it will change your life. Yeah.
And you can just walk in and ask Chantel and Ariana questions, which I think is so much nicer than having to email and ring and
Okay. Still have another one. With the recent crazy weather and possible future crazier weather events, how has it impacted Whakatane Hospital? Example, landslide, risk, or flooding?
It makes you stronger. Honestly, this hospital's gone through volcanoes, tsunami, flooding, fires in the hospital, landslips. I mean, and we just use the sense of humor of it, to be fair. But they do work with you. We have doctors that commute from Rotorua or Tauranga sometimes, and we do get cover if the slip is there. Again, just communicating with your RMO unit. How's it impacted us? Anyone want to? Oh yeah, so Katie's whispering in my ear. So we do have an ICU. We are not a tertiary hospital. We try not to keep intubated patients longer than we have to, but in the case of East Cape being closed off, or the weather not being able to fly them to Waikato, you know, we do what we can. You know, we do a lot of FaceTiming with vascular surgeons on how to do an open chest. I mean, you just do that. And you just put the call out for help if we need to. But we do have a very good incident command system for emergency that has gotten better and better even as the year. And what Anna said, we know people, and that is worth all the gold in the world, basically, if you know who to talk to and face to face and amongst disasters, basically. And we have a strong well-being, head of well-being and EAP if you're struggling from everything from home life to work life to both life. We will help you. Whatever you need. Is that about right?
Yeah.
Anything else?
I think, yeah, the main thing for us is just like Te Tauranga or Rotorua is kind of landslip territory. So as soon as we get heavy rain, we can get a little bit isolated, but it isn't really, it's got to get both of them to get us isolated. So we're normally pretty good. Normally it's only one.
There tends to be more than one route to our hospital though. So you will still come to work. But no, really, like when we were looking at places to live, it was like, ooh, if something happened there, I wouldn't be able to. But there's actually, the way the town is designed, there's actually several ways to kind of get here. So even though we can't get a patient out, you can still make it to work.
Come look after that patient. No excuses.
Very true.
Are there any hospital amenities that the doctors enjoy, or like cafe, locker room, nap room, something like that?
Yeah, we've got a RMO room.
She's got a new bed.
Yes, we've got a new king size bed. So
wait, king size?
King single.
King single.
What was magic?
Which is pretty nice for on nights, if you do manage to get an hour or two spare. And the RMO room stays pretty well stocked with tea and coffee and snacks and yeah, bickies to eat, which is especially nice on nights or on long days, because the cafe here, although it is improving on its food, it does shut quite early, but yeah, you've obviously still got an option for food in the RMO room. There's a gym which has a super low fee that you can use, like a bike cage if you're into biking to work. Yep, the coffee cart's just down the road actually, and that does real good coffee. It's always like a good excuse to get out for a breath of fresh air.
Your parking's just across the road.
Yes, exactly.
Yeah,
there's actually a big plus, isn't it? Easy parking.
No traffic in Whakatane. Get to the hospital within 5 to 10 minutes, no matter where you are from.
Yep.
Fridays, there's a large assortment of board games.
Wellness.
Wellness.
Okay.
Fridays we have wellness.
Since we don't have any further questions, I'd like to ask any last words or some sort of like word of advice from our RMO representatives and from our employers.
Come to Whakatane.
You won't regret it. Yeah, I mean, for the experience that you gain as a junior doctor, it's pretty amazing. You don't end up being in a big hospital just doing discharge summaries every day. You actually get to do lots of hands-on clinical skills. And I think no matter where you want to go career-wise, you'll benefit a lot from coming to Whakatane.
Yeah, I think it's an epic place to start off as a junior doctor. I think you gain so many skills so early on, and do it with such a great group of people along the way. So yeah, absolutely. If you're a team person, come to Whakatane.
Fantastic.
Okay, that's all for now. Maybe yeah, I want to thank everyone. To you ladies, it's so nice meeting you, and the vibe is really very good, and I'm happy to see you all. And I want to thank you for your support to ACE RMO, and I'd like also to say best of luck to all our applicants for this year's intake. And yeah, that's it. If ever they have questions that is very specific to their situation, it's either they send their queries to ACE RMO, or maybe they can direct their questions pertaining to the job opportunities to Chantel. And yeah, that's it for now. We're closing the webinar since there are no other questions. And I want to thank you guys for providing all the details necessary for the applicants to know. And I want to thank you.